Most of the primary injuries that we see here, we see a lot of neck and back, obviously. One of the reasons for that is because of today's work environment. Most people are on computers all day. And when you're sitting in front of a computer, that causes a breakdown of the actual musculoskeletal system because you're not working anything other than your fingers. And over time, posture breaks down, the head comes forward, puts more stress into the upper shoulders, back, and we start to develop neck and lower back pain. The other issue is that when you're on a computer all day, your muscles get weaker and weaker as you get older. And if you're not doing things to counteract that, proper exercise, a proper chair, sleeping in a good position, you will eventually start to develop symptoms in these areas. So as a chiropractor, what we're trying to do is to keep the body in the most natural alignment as possible. And by working with the body, what we actually do is use our hands to actually manipulate the body back into its proper position. We utilize different forms of massage, different forms of exercise, different physiotherapy techniques to try to achieve those goals. One of the biggest issues is the weakening of the bones. A lot of people we're finding are osteoporotic, even the males, and some of the cause of that is because they're low in vitamin D, they're not absorbing the calcium through their normal nutrition, and their bones are getting weaker and weaker. So you're seeing a weakened bone situation as early as the late 20s, and that's unheard of 30, 40 years ago when people actually did physical work outdoors, got some sunshine. Most people take 6 to 8 visits to get them back into good alignment if they have a good muscle structure. If they don't have a good muscle structure, then that can take up to 3 to 6 months to restore the muscle back. Predominantly is that we focus more on nutrition and manual therapy versus doing surgery and using drugs. For example, instead of doing surgery for a herniated disc, we will work manually with them utilizing different forms of manipulation or traction to try to restore the disc back to its normal position instead of going in and actually performing the surgery. There's always a place for surgery, there's always a place for drugs, but if you can try to treat it naturally, we feel that's the best way to do it. I utilize a holistic approach to look and to evaluate the body and to diagnose the body, but we also utilize mainstream medicine to work with the areas that may need physiotherapy to restore normal strength. We may utilize a lot of exercise prescription to restore the normal balance of the muscles around different joints.
For more details, visit www.dhcc.ae or call 800-HELP. Dubai Healthcare City, setting new standards in patient care.